Thank you very much for joining us on Kenya's biggest conversation. Now, we want to have a conversation about emergency medical services. And when we talk about emergency medical services, very, very many things. You see those ambulances, they're called the Red Cross ambulances, the E+ ambulances on the road. And whenever we have an issue, we see them being among the first responders and the Kenya Red Cross being among the first responders, wherever. Now, imagine emergency happening at home. You have those things, or somebody's choking, somebody has collapsed, somebody has just fallen, you don't know, somebody has broken a wrist, a leg, an arm, a nose, whatever happens, somebody has fallen down the stairs, What happens?
Walked into a wall.
Or walked into a wall and they got a
black eye.
What happens? Who do you call? How do you actually support this person by the time the first responders arrive? You're actually the first responder. So to have this conversation with us, we are joined by Dr. Christine Memusi. She is the medical director at the Emergency Plus Medical Services. That's E+ Medical Services. Daktari, good morning.
Good morning.
Welcome to Kenya's biggest conversation.
Thank you for having me.
That is the red hot seat of the Situation Room. And you're dressed red.
And so I'm dressed in red, yes.
Very good. Karibu sana. On behalf of City Muga, I'm going to give you the day's proverb. City always has proverbs from one country for an entire week. He's not in this week for the most part of this week, but he left me the proverbs. They're from South Africa. And today's proverb is, dawn doesn't come twice to wake a person up. Dawn doesn't come twice to wake you up.
That's a good proverb.
What do you think it means?
Dawn doesn't come twice. If it was to apply it to EMS, is that you can't go back, or you can't have two times a chance to save someone's life. So we always have to act as quickly as possible. It only comes once, so you can't keep on repeating, or we have to learn from our mistake. Was it once shy, twice bitten?
Once bitten, twice shy.
Yes, once bitten, twice shy. So dawn doesn't come twice. You can't go back.
You don't have a second chance.
You don't have a second chance. So the first chance you have to actualize it and ensure that you make the best out of it.
Okay. Introduce us to EMS. We see the ambulances, we see the people. We are not sure that we see the company.
Okay, so thank you. As you said, my name is Dr. Christine Memusi, Medical Director, Kenya Red Cross. So Emergency Medical Services, or Emergency Plus Medical Services, is a private company fully owned by the Kenya Red Cross. Our mandate is to provide pre-hospital care. And pre-hospital care is the care that you receive before you reach hospital. It's the care that can make the difference. Before, when you look at where did EMS come from, it came from the necessity to be able to ensure that life is saved, whether it's from hospital, from a scene, whether it's an accident scene, or someone who gets any emergency at home. How does that person reach the hospital quickly? And the care is initiated immediately to be able to revert either early death or comorbidities. So in that sense, EMS makes the difference between life and death. Yes.
We see it in the movies. Someone call 911.
Yeah.
Somebody call. It's not never the person calling. It's somebody
else
issuing instructions. Someone call 911. Okay.
So, what kind of services then does this supply? What needs do they supply? Yes, as we see the ambulance running, and we often think that, somebody's on the way to hospital without ever thinking where they've come from.
Yes.
And what's going on.
So we just know somebody's going to hospital, but we don't assume that somebody could have been picked up from their home. Or maybe sometimes the assumption is that there was an accident somewhere and then the ambulance came and picked up. But here we are saying that it's very possible for these services to come home where an accident or something of a medical nature has taken place. How does this work?
Okay, so we need to understand that many people look at emergencies as road traffic accidents. Whenever you think of an ambulance, you always assume that ambulance is only called when an accident on the road happens. But majority of our emergencies and the nature in terms of when you look at what takes people to hospital the most, or what are the majority of admissions in hospital are medical in nature. And a medical emergency can happen anywhere. A child being fed by a nanny choking, that's an emergency. A nanny burning her hand with hot water while doing her chores in the house, that's an emergency. And the emergency basically is those first aid services that are given to revert that condition and save that life. And so that's what EMS is all about. That care that's given outside a hospital setup to ensure that life is being saved and to ensure that care is initiated to prevent death or to prevent morbidity. Yes.
Who is this caregiver? What training do they have?
Okay, so in EMS, there are two types of caregivers. One, when you look at the person who provides the care, can be an emergency medical technician or a paramedic. So an emergency medical technician is basically someone who has upgraded from a first aid. So it's a certificate course that's done for a duration of 9 months. Once they graduate, then they start the EMS career as an entry-level emergency medical care provider or technician. And as they continue the years of service, they graduate to an advanced emergency medical technician. And as they pursue their studies further, then they go to school to acquire a diploma in paramedic. So a paramedic is an equivalent of a nurse in a hospital, but the setup is pre-hospital. And so paramedic course is a 2.5-year course that's provided. We do provide it at the Kenya Training Institute. And now, when you look at what a paramedic does, then they're able to work in an ambulance that is more equipped or a level of what we call an ICU ambulance, which is an advanced cardiac life support ambulance. And at the same time, so we have those who provide care to the patient in the patient compartment, but there's also the other cadre of professionals who man that ambulance, those who ensure that the ambulance reaches the scene safely, and at the same time the ambulance is able to reach the hospital safely, and we call them ambulance operators. We do not refer to them as drivers, because the training that they receive is of higher stature. They have defensive driving, they have evoc training as well as first aid training. So these are people who can actually even assist either the emergency medical technician or the paramedic at the scene to save life.
I see.
Yes.
And then what is inside this vehicle?
So what is inside a vehicle, if you really asked me that question, is what would make the difference between saving a life or not. Because the equipment inside a vehicle really do matter. And I mentioned equipment and consumables in the patient compartment. And so some of the really important things that every ambulance, and when you look at the standards of ambulances, we should have the patient bed. We should be able to provide oxygen to that patient if they need to receive that oxygen. We should be able to ventilate that patient, meaning that if the level of consciousness was to deteriorate, that we can actually intubate and actually save that life. We should be able to monitor the vitals, whether it's the blood pressure, the heart rate, the temperature, the respiratory rate. And at the same time, we should be able to give life intervention in terms of medications. So there is a scope where we say that these professionals should be able to safely use drugs that can be able to help someone who is having a heart attack, drugs that can be able to help someone who is in shock, drugs that can be able to help someone who is bleeding. And so all this entails what is required. I've talked a lot about what is required in consumables from a medical perspective, but what about a trauma perspective? Someone is involved in a road traffic accident. How are these professionals required to offer life-giving skills with the equipment that is needed? So for in a road traffic accident, someone who has fractures, you should be able to have equipment that can do splinting, that can arrest the bleeding, at the same time can also support the spine. Not only just support the spine, but equally evacuate a patient from a crash scene safely to to ensure that you do not cause any more damage to the spinal cord or to the area of injury. And we've seen a lot of the cases could be preventable. A lot of, condemning of road traffic accident patients who are condemned to a wheelchair for life could have been eradicated from how safely they were
evacuated
from the scene. That is very essential.
Dr. It's interesting that you say this because, again, a lot of what we think is influenced by things that we watch. As we may not want to accept it, but it's true. But here you are telling us essentially that a paramedic or a medical technician at this level is not a wannabe doctor, is not somebody who's aspiring to be a doctor, but an individual who is going to provide critical care in a position where a doctor or whomever is going to handle that trauma thereafter is not available. That without this individual at a crash site, for example, or at the scene of a fire or from a home emergency, without this individual with the necessary skill, the loss of life then could be much higher, or the impediment to health could be much higher. Yes. Right? So when this person essentially steps in, you're saying that there is first aid, there's health care, there's first point that is given that we often assume may not be necessary, that it's just riding along to the hospital in an ambulance. So how can you now debunk that? If somebody, for example, is taken from an accident scene in the ambulance, what's happening?
Okay.
As they're going from point A to point B, we only see the outside and we hear the alarm and the siren. But what's going on inside there that
as
can
this vehicle is moving?
Right.
Yeah.
Right. Thank you for that. By debunking, I need to emphasize that an ambulance is not a siren or is not about speed. We need to be able to change the notion that whenever we think an ambulance, it's all about speed and it's all about a transport vehicle. An ambulance is beyond a transport vehicle, but an ambulance provides care. And that care in transit or on transit is so essential that makes a difference. So if we are having a trauma patient in that ambulance, the paramedic, the emergency medical technician who is with this patient is monitoring vitals, which are essential. That information is key to the receiving facility to know that there's a patient who has had these vitals all along. As they are taking the patient from point A to B, remember they're also communicating with a dispatch center. And the information they're giving to the dispatch center is being relayed to the receiving facility. So it's a synergy. They don't work alone. And that information helps the receiving facility prepare itself, so they'll know there's a patient in shock who is coming. They will know that this is the current state of this patient. At the same time, they're already starting the intervention. So if it's a shock patient who has a fracture, they've mobilized that area that has a fracture. They have given medication, they're giving fluids. So they've already commenced the management to save that life. And that makes a difference. When you look at, for example, a patient who has had a heart attack, the first aid, if you told me you've done first aid, and when you are shown how to manage a patient who has first aid for someone who has had a heart attack, giving that, for example, high dose of junior aspirin makes a difference. That positioning makes a difference. And that is why it's important for people to understand that ambulance services can save life. There's a lot of research has shown that many people prefer calling an Uber or rushing a patient with any means of transport that is near, and never really think about calling an ambulance first. There's a perception that it could be a vehicle of death. There's a perception that itachelewa. But if you really look at the care that's given, and what's in that ambulance, it's the equivalent of what is in any bed or in any hospital. That's top notch. And so really the importance is to realize that an ambulance can actually save your life.
It's the one that stands between things going very south, like 6 feet under south, and actually keeping somebody alive. Kudos to Kenya Red Cross for starting E+ services. Because since then, now we see more ambulances on the road. Before that, we'd only see, those military ambulances, police ambulances, and several from the major hospitals, the PGHs. those are the ambulances we used to see. And then the private hospitals would come up with ambulances. Do we have a coordination of the ambulance services in this country? Like, does EMS have a same dispatcher as the ones for KNH, as the ones for Nairobi Hospital, Aga Khan, and the others?
Thank you for that. Currently, no. And when you look at emergency medical services as a country, we could say we're in the implementation stage. A lot needs to be done to ensure that these emergency bodies that entail or work together are one. We have been working a lot in silos. So you'll find that the emergency care providers, as for example, Kenya Red Cross, who we are, work very differently from the fire departments, work very differently from the police department, and also the hospitals. We should be able to be one because all these bodies entail emergency care. When they are one, then we can actually have our unified hotline number.
Yep.
And at the same time, we can be able to also have a unified dispatch center. But as Kenya Red Cross, we do have our dispatch center that we connect together with the ambulance services. It is the center of our operations. They are to us our first responders, because when the call comes, when a call reaches our dispatch, they are the ones to give pre-arrival instructions. They're the ones to be able to decipher what type of ambulance should we send to the caller and how quickly can we send this ambulance to the caller to be able to reach within what WHO entails of response time or ideal response time. So that is how we do our operations. We have a dispatch center, but as a country we need to be able to have one unified. But in our collaborations with the counties that we're working with and where we provide our services, we have been able to empower them to have their own referral systems and actually dispatch centers that are able to now collaborate with us on the ground to be able to provide the care, the emergency care service that's needed by the people.
Let me go back a little bit to what you spoke about, because then that just connects us to what could be available. That when somebody has fallen down at home or lost breath or whatever, the first response is actually not an ambulance. The first response is who's the closest person that can drive us, or can I call a taxi?
Yes.
Without thinking that in an ambulance there is this first port of care that is being delivered before one gets to hospital, right? To the closest health center. So if we also look at other areas, they're all over the place. It's the first thing that you do, that somebody is in that position, somebody is calling 911, and an ambulance is going to show up. Doesn't matter. It's not going to be a cab. It's not going to be somebody driving you. Somebody's going to call that. So then what would be the recommendation for folks to say that if something happens, the first port should be an ambulance, to make sure that the care then is being delivered? Because also we have heard, unfortunately, that people are transporting others to hospital when something has happened and they've died in the cab or they've died in the vehicle, and we're saying that perhaps there's something that could have been done to save them.
True. So what needs to be done to answer that is we need to be able to educate as many Kenyans as possible of the importance of first aid. And educating means that we're not just telling them do first aid, but actually ensure that they are getting these life skills. These life skills make a difference. Someone who is fast trained, who has first aid training, can be able to initiate the care before they call an ambulance. The other thing we need to do is to be able to educate as many Kenyans of the importance of ambulance services. We need to be able to market these services. We need to be able to ensure that everyone knows who to call, the hotline number for ambulance provision. And so those two really make a difference, because if you were to, let's say, fall down and someone in the house knows what to do, or you cut your hand and someone is able to knows what to do, like arrest the bleeding, that actually saves life, because you're able to prevent excess loss of blood. Or if it's that burn patient, being able to cool the area of burn, remove the clothing and all, makes a difference. You know, if it's that child who is choking, being able to do that, the back thrabs makes a difference. So we need to, one, educate as many Kenyans. You know, that's one of the mandate of the Red Cross, to ensure that first aid knowledge is achieved and is taught. We have seen Scandinavian countries that have been able to achieve 80-90% of their population with the ability to have those life skills.
Yeah.
And they've gone a step further to ensure that the access of AEDs are within points where very populated malls have an AED, or in malls their staff, whether it's a security, are able to provide first aid. And so there needs to be a synergy, if you asked me. A synergy from first responders to the scene. In Kenya, especially when you look at our road traffic accidents, our first responders are usually the boda riders.
Yep.
Are these boda riders trained in first aid? That there needs to be that conversation, and there needs to be that actualization. Number two, in places where Kenyans converge in large numbers, do we have first aid boxes or kits, and do we have even AEDs that can be able to defibrillate the heart in case someone collapses and they're actually having a heart attack, or the heart arrests? So these are measures that should be able to be achieved. And lastly, the numbers, as we know, 911, do we know that our short code for Kenya Red Cross is 1514? Very simple numbers that Kenyans can actually memorize and, have in a situation where you have saved that life, but you need an ambulance to be able to, you have already given the first aid to that life, but you need an ambulance to be able to come and now continue with the care and evacuate that patient to hospital. Then the short code 1514 or 0700 395 395 or 0738 395 395. Those are ambulance services numbers. Those are numbers that every Kenyan should have with them.
Well, as we gear up to the national launch of universal health coverage and UHC, we'll be looking at it, starting from that primary health care and also primary emergency response. And these are important. The things that you've said, making sure that we have people who are trained in first aid in every community. Does your community have somebody who's actually trained in first aid? Does your court have? Does your block of apartments have somebody who's trained in first aid? That all of you know, we can call on this person. So we have this whole move towards having community health workers at every community. These are people who would also have this kind of skills. They can also help get other people who are called, first aid or emergency champions in a community. So if a community is well aware of these things and creating such within itself, then it helps. Next thing, know who to call. Is it the number 1514? Just dial 1514 and call. 0700 395 395. I'm plugging E+ numbers here again. And I want to give this because I have lived in a community that was very active on making sure that we have some sort of emergency response. Green Park Estate in Athi River registered every household with the emergency E+ services, so that in the event of an emergency, you call a number and they already know that Green Park, we have a community and we have a relationship with them. An ambulance is sent immediately. And it has helped a number of people and a number of times. And this is a good thing. Dr. you've said, what we need to see is basically having the coordination of all these services. And particularly if it just goes down to county level. If a county such as Nairobi would coordinate all its emergency response, we know we have fire department, we've got the police, we've got several hospitals with ambulance services, we've got private ambulance services such as the E+. How do we coordinate all this? How can we have one number where in Nairobi you call and then all this is coordinated? If this were to work, it would make things better.
Yes.
The other thing is bringing it down to household level. Training and creating awareness on first aid. You say that's part of the mandate of the Kenya Red Cross is that.
Yes.
But for you to be able to do that in a population of 54 million people, you need a lot. Who would you work with to train us on first aid?
Well, the training of first aid should begin from elementary school. That knowledge should be part and parcel of any education system, if you asked me. And it should be free, because the knowledge you're impacting from an early age makes a difference. For those who are working in institutions and organizations, the Kenya Red Cross is able to work and partner with them where we can come and train the institution as a block. For those in estates, we can equally do the same. But I would like to target the young because the future belongs to them. And when you look at our numbers, majority of our youth will be the future. And so for me, I would say work with the educational system, with the government, to ensure that first aid is commenced from school. Have first aid clubs. I remember back in my day, we actually had St. John First Aid Club, but I don't know if it's still as active as it was back then. But the skills we started learning from the time I was in class 5, 6 might probably have been the spark for me to actually pursue a medical career. But all in all, this is a necessity. We should be able to say that first aid should be a necessity to all, and first aid should be able to be taught to all, from as an early age to adult. We should be able to have that knowledge and skill to save that life.
Should it be mandatory? Because I imagine what we're saying is that we have come from a place where we've been so community-led and community-oriented. There's been a little bit of a shift. Should we be coming back full circle? Because you can imagine what happens when there's an accident. Everybody coalesces about a certain area. So the aspect of community is still there.
Yes.
Should it be something that is part of your mainstream learning and understanding? It shouldn't be an elective. It shouldn't be extra curricular.
Yeah.
It should be part of the mainstream. The same way we have things like sex education. It should be there as well, because at one point or another, you will run into a situation where somebody does need that first respondent care.
That's very true. I want to echo that. It should be mandatory. And mandatory and fun, It shouldn't, I think sometimes when you look at education and when we look at where we came from, 844, it was very stringent. But this is something that should be made fun and mandatory to all. When you look at communities, it should be all. Whether someone is not educated at all, it should be a skill that everyone should have. Because there's that percentage of Kenyans who have not been able to achieve, for example, or even reach class 8. There's that percentage, and we need these people to be able to have this knowledge and skills. We have our domestic workers, who we leave our precious children with. Are they first aid trained? Can they be able to help your child when you're busy at work trying to make ends meet? So it's a skill that should be achieved and disseminated to all, if you asked me. And mandatory, yes. Just like when you look at how they want, once you reach 18 years, you go to the National Police Service or something. Make it mandatory from elementary school, and for those who are willing to learn, make it accessible and affordable, so that as many Kenyans as possible can have those first aid skills that will make a difference in a scene where there's an accident, whether it's a road traffic accident or an accident at home.
Do you do this training at community level? So people who are listening, and you've mentioned our house helps in many instances, do you train? Can someone send someone to you for training, or can a community invite you to come and train them?
Yes, we do offer the mandatory. We do offer the training from a community based. Remember, the first aid training can take a maximum of 3 days, based on what the community needs, and looking at what are the emergencies that can arise in that community. We do offer, and it is available. We can partner with the communities and be able to provide it, but also partnering with the schools and offering these skills is very feasible and achievable.
It's something that can be done.
It can be done, yes.
And rolled out immediately.
Immediately.
So looking at the regulation of all of this, it does seem right now, obviously we know that disaster management right now is, putting it kindly, a mess, right? So if we're going to talk about trying to get towards regulation, so much so that when there's an accident or there's something that has gone wrong, or I'm in the house and you can actually call 1514 or whatever number that is, that it's regulated in such a way that there's dispatch, and in order for that to happen, the regulatory mechanism has to be in place so that you know who's going where, who's been mapped for what. What would it take to have that in place today? So much so that it is ingrained in people's minds that this system is in place for this particular thing to happen.
Okay. So what needs to be done is the government backing and support. Because when you look at that, what it means is that we need to have a regulatory body that is able to ensure that EMS is coordinated and the services that are provided by whether ambulance services from hospital or private entities is correct. Regulating what even an ambulance should look like and what an ambulance should have. Regulating the skill sets of these ambulance providers. That is something that should be achieved. A lot has been worked on by the government to actualize this. Laws have been written, bills have been passed. And so where we need to be at is the actualization of these policies that have been inputted and shared, collaborations by Ministry of Health and the private entities that provide emergency medical care in this country. At the same time, we need to be able to have a unified system of EMS where all these disaster components, those who provide disaster care, whether it's the police working together with the EMS providers, working together with hospitals, working together with the fire, all these need to be under one umbrella. So it is achievable. The actualization is work in progress. Whether it's through the Universal Health Fund or Universal Health Cover, working all to ensure that they unify their systems is achievable. When is a big question.
The jury's still out.
Yeah, when
Let's use the example of Kenya Red Cross. How long ago did Kenya Red Cross establish the Emergency Plus Medical Services? Which year?
It started in 2010, and it's actually a very humbling story that started the birth of E-Plus.
Yeah.
E-Plus was birthed from a need to evacuate a member who had been involved in a road traffic accident. And at the time, there were no ambulances, or the ambulance provider that was there could not reach the member because it was interior of Kenya, actually, Isiolo. So to be able to reach that life and bring them to Nairobi where the care could have continued took days. And so that birthed where E-Plus came from, and the necessity of we need to be able to provide ambulances to Kenyans. If we ourselves cannot access the services, what about the rest?
Yeah.
And so from the last 13 years, we have grown from 2 ambulances to 128 state-of-the-art ambulances. And we know that we are still yet to continue because the population is increasing, EMS is ever evolving, and so we are changing with that. But we've been in the market for the last 13 years.
13 years, 138 ambulances. Of course, very many people working in the ambulances, the medical technicians and the paramedics and the ambulance operators. The staff, how many?
We are close to 300 staff.
Okay. And you have a single dispatch
Unit, yes.
So this number goes to a central location.
Yes, it does.
And then the operator knows how then to dispatch.
Yes, the dispatcher knows how to dispatch an ambulance.
How to dispatch an ambulance.
Yes.
And the follow-up.
Yes.
So if this has happened in 10 years,
Yes.
and we've been within these 10 years, we've also been talking about, the national EMS system and how it can be done. It's possible to roll it out.
Yes, it is.
So the message that we are sending here to Interior and Health and the others is, look, this thing can be done. And I'm pushing this because we have looked at the national disaster management. So we had a multi-stakeholder platform that was dealing with the disaster management in the country and looking at how they are brought together. It brings in Red Cross, it brings in the police, it brings in the military in some cases. In case of an emergency, these are the ones who respond. But no formalized framework or structure of national disaster management. If we have a disaster, we cobble up a team at that point, right? Is that the same thing that happens up to now?
Yes.
You're part of a multi-stakeholder, blah, blah, this and the other.
Yes.
There have been pushes to have a National Disaster Management Authority bill taken to Parliament and passed. It has died, it has flopped. This is a message basically from the Situation Room to the powers that be that, come on.
We can do better. No, we can do something. Not even better. We can do something.
Surely. Yeah. Because we see emergencies all the time. And when you get to a point where emergency, everybody knows Red Cross will come up, and yet we have a government in place Shouldn't be the case. But kudos to the work that you're doing. Now, if somebody calls 1514 in the event of an emergency,
Yes.
who pays for this service?
It's a free service. It's the 1514 will not be charged, and so when you call, the call will go to a dispatch center, and the dispatch center is manned by emergency medical dispatchers who are medics, and they're able to really understand you as a caller. One, your demographics, your location, and what is the nature of emergency. The moment we're able to understand that, then we're able to look at where our ambulances are. Remember, we have ambulances in every county of our lovely nation. And so we're able to look at the nearest ambulance to you using our GPS systems that we have put in place to be able to now look and see the nearest ambulance and dispatch that ambulance to you, giving them the information that you have given us.
Yeah.
But at the same time, we're able to now, the dispatchers are able to give you, the caller, medical advice or what you can be doing.
Yeah.
Those first aid advice at what you can be doing before the ambulance reaches you.
Right.
Yes.
When it comes, do I pay?
Well, when it comes based on as we get your details, remember, if you have a national health insurance fund, we have collaborated with the NHIF to be able to provide NHIF members ambulance services during an emergency. So what we do as ePlus is that we have different packages of how to be able to receive our services. So you can either be a member of ePlus from either an individual level or from a family level, family entailing 6 members. At the same time, you can be a member based from corporate. Like now we could come and partner with Standard Group and be able to provide emergency services for all Standard Group members. We do the same thing for blocks, like you said, in terms of like estates or communities that live together. We are able to provide them that emergency services. We do also partner with schools, where we do provide emergency services to schools. All this based on the caller. If you're a member, you'll give us your member number, and we're able to come and provide that ambulance service. The good thing about membership is that it is not limited. Once you become an Emergency Plus Medical member, then what happens is you have unlimited access to ambulance services for any emergency. Unlimited times, I need to emphasize the word for unlimited. Most covers with some of our other ambulance providers in this country, they give you 5 or 10 evacuations in a year. For us, it's unlimited. And that is something that we take pride of. But as much as we might want to look, as much as we are private, remember we also have we have a corporate social responsibility, and it's something that we're very proud of. And in our corporate social responsibility, it means then that any accident that happens on the major highways and you're the first on scene, please call us, because it is our mandate to evacuate those accidents to hospital. We took this up because when you look at what happens at road at an accident scene, many times that crowd is taking photos or they're trying to their own way, in their community way, to try and save that life. Many times with the lack of skill, they do more harm than good. So that's where we come in, and in our as a corporate and as a responsibility to the society, we offer those evacuations for free. So as long as you're a member, the least fee that we do offer for membership is 3,000
per year.
Per year.
Okay.
And as long as you're a member, remember 3,000 in comparison to calling at an ambulance or using taxi services. And when you really look at what you're getting for that 3,000 is a lot. And so as long as you're a member, we'll always evacuate you. But I also need to emphasize that we also do have packages where we do offer ambulance services for our elderly, our elderly parents who have are retired and are sickly. Instead of worrying about them, you can actually make a difference in their lives by just paying 2,500 a year for your mom or dad to be able to receive ambulance services. And so in that we're able to pick them and take them for their medical checkups, for whether they're on dialysis, as many times as need be.
Do you take patients who've been in a situation, whatever that may be, to the nearest medical facility or to their preferred medical facility, taking into consideration there's an emergency or somebody who's taking normal care from a particular facility would prefer that they be taken there? How does that operate?
So for our transfers, whether it's a hospital transfer or we're picking a patient from home, for members, we give them the chance to choose which is their preferred hospital. For example, if I'm picking you from home and your doctor is in Nairobi Hospital, we will take you to where your doctor is. But at the same time, we need to I need to make it clear that if we pick you and maybe the nearest hospital is a health center, and we know that that health center will do more harm than good, what we will do, we'll take you to where that continuity of care will be received.
Based on the care you need.
Based on the care you need.
Okay.
For the receiving facility,
Yes.
so long as an ambulance has brought a patient, they will receive the patient and continue with care, or must there be some kind of coordination of pre-arranged that we know that ambulance from X we will receive, or will any ambulance that comes, so long as it's bearing a patient who needs care, they will receive? What's usually the arrangement between that?
So what's usually the arrangement is we need to notify the receiving facility that we are coming.
Okay.
And so that's the synergy and the seamless processes that entail EMS. So as the ambulance is with this patient and taking this patient to hospital A, the dispatch is ready notifying hospital A that ambulance X is coming, carrying this patient with this condition, and they will be there in the next 10-15 minutes. So that information is key. So that that hospital is able to ensure that it is prepared to receive that patient.
Do they ever say, no, we can't accept?
They shouldn't, actually, according to the
According
bill.
to the law,
According to the law,
they shouldn't.
They shouldn't.
Okay. Because it's
According
an
to the law.
emergency.
It's an
Right.
emergency.
Okay.
And so there'll be no conversation about, okay, so you ambulance operators, you've brought this person, we need a bit of a deposit, 5,000.
No.
It shouldn't be.
It shouldn't be.
Okay.
And that is what we are hoping is fully actualized in the sense that we have a health fund. Yes.
People who are listening and they'd like to register
Yes.
with Red Cross, how do they do that?
So if you would want to register with us, even if you call the 1514 short code, once it's received at our dispatchers are trained to be able to market. Remember, we're all marketers in our own accord to market the services that we provide. And so once you call us, then we're able to now give you the processes of how to register. And how to actually become a member. And so based on, the information we'll need to gather from you, are we giving you family cover, are we giving you individual cover, and if it's family, how many members? Once we get the details, because we will be able to send you a form, whether it's on email or your WhatsApp number, then once you fill in the details, we're able then to give you cards and register you and give you a number that actually now you become an E+ member.
Okay.
Yes.
Takeouts from this conversation this morning: number one, it's important to have first aid training across the country. Let's start it at schools. So let's champion for schools to actually adopt this and make it a mandatory thing. Okay. And then let's have first aid training at community level. Wherever you live, do you know that you have first aid champions? If you live within a certain neighborhood, you have a Nyumba Kumi, yes. You have an estate, yes. Do you have an estate first aid champion, or 2 or 3? And Red Cross can also come and train you for that. Number 3, if you can, please register. No, please make sure that you try and can register for emergency rescue services. Red Cross numbers, I'm going to plug you here because you've done a good job of telling us what you've been doing. Call 1514 in the case of an emergency and you need an ambulance. 1514 1514 or 0700 395 395 or 0738 395 395. See, like that.
Just like that.
Very good. Thank you very much, Dr. Hari, for joining us today.
Thank you.
And you need to come again because a lot needs to be said about emergency response and even about first aid. Next time you come, we'll break it down into, okay, so you're in a household and this happens, what do you do? Okay? Because we need to start having those conversations.
This is the Situation Room, the only way to start your day.